As a cancer survivor, an ache in your toe, a twinge in your back, a catch in your hip, every pain may feel like a screaming, panicking question mark. A new ache turns into a spiral, a twinge, a pull, a pressure, a flutter, or a strange sensation suddenly sends your poor mind racing ahead of your body. You may replay your diagnosis story. You may remember the symptom you almost ignored the first time. And now you're left to wonder if you're missing something again. If any of this feels familiar, I want you to hear this clearly right from the start. These racing thoughts don't mean you are weak, and they don't mean you are doing survivorship wrong. What you are experiencing makes sense. And there are real biological and psychological reasons your body may be behaving this way. This is the After Cancer Podcast. I'm your host, oncology physical therapist, Dr. Leslie Walke. For more than 3 decades, I've walked alongside people living with and beyond cancer. Whether you are a survivor, a caregiver, or part of a clinical team who cares for them, I'm glad you're here. Because life after a cancer diagnosis can feel uncharted and confusing, even when you have a great medical team. In this podcast, evidence, empathy, and the real human experience come together to help you navigate the physical, emotional, and practical realities of cancer and the life that comes after. This is the After Cancer Podcast, rooted in medicine, spoken in human. Welcome to episode 4. Here we're talking about something that shows up for so many people after treatment ends, often quietly, often privately, and often without a language to describe it. That state where every sensation feels suspicious, where you notice everything, and where nothing feels neutral anymore. This is living with a hyper-vigilant body, and we'll talk about why it may develop, why it so often intensifies after treatment ends, what's actually happening in your brain and nervous system, how to tell the difference between something that deserves attention and something that deserves time, and how to slowly and gently rebuild trust in a body that once delivered you very bad news. This is not an episode about telling you to calm down, stop worrying, or just be grateful treatment is over. It is about understanding your body, respecting what it learned, and learning how to live inside it again, without being on constant alert. When cancer enters your life, it doesn't just affect your organs or your cells. It can fundamentally rewire your expectations and your sense of safety. Before cancer, most of us walk through the world with a quiet assumption that our bodies are basically reliable. We assume aches will pass, fatigue means we need to rest, and strange sensations are just a part of being human. We assume continuity. We assume tomorrow will look roughly like today. Cancer breaks that assumption. Because at some point, a symptom wasn't just a symptom. It was cancer. Maybe it was a lump you almost dismissed or randomly showed up on a screening test. Maybe it was pain that didn't fit any obvious pattern. Maybe it was bleeding, coughing, shortness of breath, unexplained weight loss, or exhaustion that kept getting worse. Your body sent a signal, and that signal changed everything about your life. From a neuroscience standpoint, your brain encoded that experience as threat learning. When something dangerous happens, especially something possibly life-threatening, the brain's threat detection system becomes sensitized. The amygdala, which helps detect danger, becomes more reactive. The hippocampus, that stores memory, links sensations to fear. The nervous system learns that bodily signals require immediate attention. This is not a conscious choice. It is an automatic survival response. Your brain learned that missing a signal once had enormous consequences, so it decides that it will not let that happen again. That learning does not disappear when treatment ends. In fact, it often becomes more pronounced. One of the most surprising things survivors tell me is this: I was okay during treatment. It's after treatment that everything got louder. And that experience is incredibly common. During treatment, there is structure. There are appointments, scans, labs, infusion schedules, radiation calendars, and surgical follow ups. There are professionals watching your body closely. Your nervous system knows that someone else is monitoring for danger. Even when treatment is physically and emotionally brutal, your brain understands the environment. There is a plan. There is containment. When treatment ends, that containment fades. Appointments space out, scans become less frequent. You're told to just call if something changes, without much guidance on what change really means. Responsibility quietly shifts back onto you. And your nervous system responds by saying, okay, then I'll watch. And it does. It watches your body constantly: your energy, your digestion, your pain, your sleep, your breathing, your memory, your mood. This is not generalized anxiety. This is protective hypervigilance. Your nervous system is trying to make sure nothing dangerous slips by unnoticed again. Hypervigilance is a state of constant threat detection. Physiologically, the body stays in a mild but persistent fight or flight mode. Stress hormones like cortisol and adrenaline may remain elevated. Muscles stay slightly contracted. Breathing patterns shift toward faster, shallower breaths. The brain's filtering system becomes less effective, meaning sensations that once would have been ignored now break through into conscious awareness. Sensory amplification occurs. The body feels louder. From a patient perspective, this often sounds like, I feel every little thing now, or I can't tell what's normal anymore, or my body feels unfamiliar and unpredictable. I think of a patient often I worked with years ago, a woman several years out from breast cancer treatment. She told me that before cancer, she barely noticed her body at all. After treatment, she said she felt like she was living inside a smoke alarm. Every sensation feels like it might mean something terrible. Another patient described it as having an internal radar that never shuts off. These are not metaphors of weakness. They are accurate descriptions of a sensitized nervous system. Here's something important to understand. When your nervous system is on high alert, your body will actually generate more sensations. Not because something is wrong, but because attention amplifies perception. This is well documented in pain science and trauma research. The more the brain scans for danger, the more it interprets neutral sensations as potentially threatening. The body then responds with more tension, more discomfort, more internal noise. The more you watch your body, the louder it becomes. This creates a feedback loop that can be incredibly distressing. This is where many survivors get stuck, and it's an essential distinction to make. There is a difference between body awareness and body surveillance. Body awareness is gentle. It notices sensations without judgment. It allows information to come in and pass through. Body awareness sounds like curiosity. Body surveillance is urgent. It interrogates. It demands certainty. It assumes danger until proven otherwise. Body surveillance asks, what is this? Why is this happening? And what if this is cancer again? Once that loop starts, anxiety feeds sensation and sensation feeds anxiety. It becomes a self-reinforcing cycle that is exhausting to live inside. What makes this even harder is that from the outside, people often expect you to feel relieved once treatment is over. Friends, coworkers, even some clinicians may say things like, you're done, you should be celebrating, or at least it's behind you now. But inside, your body doesn't feel safe yet. That mismatch between external expectation and internal experience can lead to shame, confusion, isolation, and silence. Many survivors stop talking about their fear because they don't want to seem ungrateful or dramatic. Another layer we have to acknowledge is this: your body really is different after cancer. Treatment changes tissues. It affects nerves, hormones shift, muscles weaken, joints can stiffen, scar tissue can form. Fatigue can linger for months or years. Sleep patterns can change. Cognitive processing can feel slower. So when someone tells you everything looks normal, that doesn't always feel reassuring because your lived experience doesn't feel normal. The truth is more nuanced. Your body may be changed, but change does not automatically equal danger. Learning to distinguish between expected post-treatment changes and true warning signs is one of the central tasks of survivorship. One of the most common questions survivors ask is, how do I know when a symptom matters? This is where we need practical frameworks, not blanket reassurance and not dismissal. When something new shows up, it can help to slow the moment down and ask yourself a few questions. Is this persistent? Does it last beyond several days without improvement? Is it progressive? Does it steadily worsen rather than fluctuate or settle? Is it unexplained? Meaning, is it clearly related to activity, stress, sleep disruption, illness, or known treatment effects? If the answer to all three of these questions is yes, that's appropriate to bring to your medical team. That's not being dramatic. That's being attentive. If the answer is no, it isn't reasonable to observe. Observation is not ignoring. Observation is wisdom. It is giving your body space to speak without immediately assuming the worst. Living in a hypervigilant body comes at a real cost. Chronic nervous system activation drains energy. It worsens fatigue. It heightens pain sensitivity through central sensitization. It disrupts sleep architecture, making rest less restorative. It affects mood, memory, and concentration. It can narrow your world. Many survivors unconsciously start avoiding activities they once enjoyed because they feared triggering symptoms. Movement, travel, exercise, social events, and even joy can feel risky when your body doesn't feel trustworthy. Your body never fully receives the message that you are safe right now, and safety is essential for healing. You cannot rebuild trust in a body you are constantly policing. Rebuilding trust after cancer is complicated, and it deserves patience. Many survivors feel betrayed by their bodies. Your body missed something, or it didn't warn you, or endured treatments you didn't choose or changed in ways you didn't consent to. That sense of betrayal often sits quietly beneath hypervigilance. And trust does not come back because someone tells you everything is fine. Trust comes back through lived experience, through routines that feel predictable, through movement that feels supportive instead of punishing, through breathing that slows and settles, through repeated experiences of noticing a sensation and discovering that it passes without catastrophe. Trust is rebuilt in these small moments, not grand declarations. Let's talk now about tools, not fixes, not cures, and not ways to eliminate fear forever, but tools that help you live alongside it. The first tool is naming what's happening. Simply saying to yourself, this is hypervigilance, not danger, can interrupt the spiral. It creates space between sensation and story. It engages the rational part of the brain and softens the threat response. The second tool is shifting from scanning to sensing. Instead of asking what's wrong, ask what do I feel? Temperature, pressure, movement, heaviness, lightness. Describe sensations neutrally, like a scientist observing data, not a prosecutor building a case. The third tool is regulation first. Slow your breathing, lengthen your exhales, ground through your feet, your seat, or your hands. From a physiological standpoint, long exhales activate the parasympathetic nervous system, sending signals of safety to the brain. You cannot think your way out of a dysregulated nervous system. The body has to feel safer before the mind can settle. Another helpful tool is creating a container for worry. Tell yourself, if this sensation is still here in a week or after a certain marker, I will call my provider. That gives your brain a plan. It gives worry a boundary. Without a container, anxiety expands endlessly. Movement is another powerful tool. Not movement as punishment, not movement to test your limits, but movement as reassurance. Gentle, intentional movements sends powerful signals of safety to the brain. It reminds your nervous system that your body can't move through the world without constant harm. It reminds your nervous system that your body can move through the world without constant harm. As a physical therapist, I have seen over and over again how appropriate movement helps survivors reconnect with their bodies in a way that words alone cannot. There are times when hypervigilance becomes overwhelming. If you find yourself unable to sleep, constantly anxious, avoiding life, panicking about sensations, or unable to quiet your thoughts, that is not failure. That is not weakness. That is a nervous system asking for support. Trauma-informed counseling, oncology-aware mental health care, and cancer rehabilitation professionals can help recalibrate your internal alarm system. Support is not a sign that you are coping poorly. It is a sign that you are taking your survivorship seriously. Occasionally in these podcasts, I'm going to throw in a dose of vitamin L, a dose of vitamin Leslie. And here is one of those times. Your body is not your enemy. The hypervigilance you feel is not a flaw. It is evidence of how hard you fought to survive. Your body learned to protect you. Now, the work is teaching it when protection is no longer needed. That takes time. It takes patience, and it takes compassion. There will be days when a sensation shows up and you spiral. That does not erase your progress. There will be days when you notice something and let it pass. Those days matter. Trust does not return all at once. It returns slowly, quietly, in pieces, and that is enough. So, with the reflection prompts for this episode, think about a recent moment when a sensation in your body immediately made you worry something was wrong. What story did your mind begin to tell you in that moment? And what might it look like to pause and observe that sensation with curiosity instead of alarm? Number 2, since your cancer experience, how has your relationship with your body changed? Do you feel more like you're listening to your body or more like you're monitoring and questioning it? And number 3, what is one small action this week that might help you rebuild trust with your body? Something that reminds you that your body can still support you, not just surprise you. And again, at any point you have any questions about what to look for, what you're feeling, always talk with your medical oncologist or someone on your cancer team. They are there to help you. If today's episode resonated with you, know this: you are not alone in this experience. The hypervigilant body is part of the long mental game of survivorship, and it deserves language, understanding, and care. Coming up in episode 5, The Day the World Changed, understanding the shock of diagnosis. Behind every statistic is a real person navigating diagnosis, treatment, and recovery. And for many people, the hardest moment of that journey is actually the very beginning, the day everything changes. In episode 5, we'll talk about the shock of hearing the words, "You have cancer." Before we go, a big shout out to ABCD after breast cancer diagnosis. My friends over at ABCD provide virtual, free, personalized emotional support by matching anyone impacted by breast cancer with a trained volunteer mentor who has a similar lived experience. Learn more about getting support or becoming a mentor at abcdbreastcancersupport.org. This episode unpacked a lot. If you can, go for a walk, do some gentle stretching, or some self-care. You deserve it. Treat yourself like you are the most important person on this planet, because you are. This episode unpacked a lot. If you can, go for a walk now. Do some gentle stretching or some self-care. You deserve it. This is the After Cancer Podcast, and I'm Dr. Leslie Walke. Thank you for being here, and exercise like your life depends on it, because it does. Peace out. Let's talk again soon.